I want to tell you something that nurses talk about among themselves. There's a phrase that comes up again and again in hospitals and clinics across Nigeria. I'm sorry, I was having a network issue. Like I said, there's a phrase that comes up again and again in hospitals and clinics across Nigeria, and that phrase is, if only they had come sooner. If only they had come sooner, the bleeding could have been managed, the infection had not spread so far. If only they had come sooner, the stroke damage would have been less severe. And if only they had come sooner, she would still be here. If only they had come sooner. Okay, and these six words represents one of the biggest health across the biggest health crisis in Nigeria. Not a lack of hospital, not a lack of medicine, not a lack of trained healthcare workers, but a pattern of people arriving at hospitals and clinics when things have already gone too far. And when that started as something manageable, has become something critical, when the window for easy intervention has already closed. And the reason people come too late is almost never because they do not care about their health. It is because they did not recognize what their body was telling them enough, and because they explained away the symptoms because they were too afraid, because they were too busy, because they trusted the remedy at home over a visit to the hospital, and because nobody told them what the early warning signs look like. Today, we're going to change that. We're going to talk about the signs and symptoms that healthcare um, workers, particularly nurses, who are at the bedside every day, see patients arrive too late. And we are going to go through the conditions that kill and disable um, Nigerians, and we're also going to talk about the early signs, the early signals, the ones that most people brush off, and that comes weeks and months before things become critical. This is not a scary session. I want to be clear about that from the beginning because this is an empowering section, and because knowledge is exactly what stands between a symptom that gets managed early and a condition that becomes an emergency. And by the time we finish today, you're going to have that knowledge. Welcome, welcome, welcome. Happy Thursday, everyone. I am so glad you choose to be here. I wanted to drop a hello in the comments right now. Tell me where you're watching from, and I want to start with a very honest question. Have you ever arrived at a hospital or clinic and been told you should have come sooner? Or have you ever been the family member sitting in a waiting room, wishing the person you brought had not waited so long? I want you to type yes in the comments because I think this room is going to be full of yeses. My name is Loretta Ngele and this is the Safe Delivery Project, and we are under the Do Take Action family. Under the Do Take Action family, every Thursday at 3 p.m., we show up here and have the kind of conversations that actually change how people take care of themselves and the people they love. Now, today they're not guests, it's just me and you, and it's two full 1 hour of some of the most important health information I have ever shared on this platform. So get a water, get comfortable, and let us begin. Okay, I'm going to talk. No, sorry. Before we get into the specific conditions and their warning signs, I want to spend some time on something that I think is just as important. Why do Nigerians wait so long before seeking care? Because this is not a character problem, it is not laziness or carelessness. It's a pattern that has real, understandable reasons, and understanding these reasons is the first step to changing them. And number one, that is the reason number one, the cost barrier. This is the most honest place to start. Healthcare in Nigeria requires significant out-of-pocket spending for most people. A consultation fee, registration, tests, medicine, transportation to the facility, and for a family that is already managing tight finances, going to the hospital is a financial decision as much as health one. And the calculation many people make is to let me wait and see if it gets better on its own before I spend money I may not have. You can imagine that. And I understand that calculation completely. I really understand that calculation completely. And I do not judge it, but here is what the mathematics of healthcare actually looks like. A condition caught early is almost always significantly cheaper to treat than a condition caught late. A blood pressure checks and medication for hypertension at a pharmacy or primary health center costs far less than the emergency management of a stroke caused by years of uncontrolled hypertension. A malaria test and treatment costs at a clinic cost far less than a hospital admission, for severe malaria with complications. Early is always cheaper, like I said, but you have to go find out early. And the reason number two is the self-treatment culture. Nigeria has a very strong culture of self-treatment. Before going to a hospital, most people first try something at home, which is the normal name that they normally call the herbal drugs, which they call agbo. It's the normal way of these herbal preparations. You know, remedies passed down through the family over the counter medications from a chemist without a prescription, prayer and fasting, and these are not wrong in themselves though, but many of them have genuine value, and most of them come from a place of care, but they become dangerous when they delay proper diagnosis and treatment of conditions that are progressive. And the person who has been managing symptoms with agbo for 3 months before coming to hospital has given a condition 3 months to develop unchecked. And the person who buys antibiotics from a chemist based on self-diagnosis and takes an incomplete course has potentially made the real infection harder to treat. And so self-treatment that is a first response is sometimes fine, yes. Self-treatment that replaces medical care indefinitely is also dangerous. And the reason number three is fear of what they might find. This one is very real and very understandable. Many people avoid the hospital because they are afraid of getting bad news. The thinking is, if I do not go, I do not have to deal with whatever they might find. If I stay home, maybe it will go away. If I go, they might tell me something I cannot cope with. But here is the truth. Not going does not stop the condition from progressing. Whatever is happening in the body continues to happen whether you acknowledge it or not. And the difference is that not going remove the possibilities of catching it when it is still manageable. So fear of diagnosis is one of the most common reasons people arrive at the hospitals with advanced conditions that could have been treated effectively if caught months earlier. And fear is understandable. But in health, fear of knowing is more dangerous than knowing. And also the reason number four, we have the normalization of symptoms. When a symptom has been present for a long time, people stop seeing it as a symptom and start seeing it as just how their body is. I have always had this lower back pain, my mother always used to have these headaches, that's what they tell. I have been waking up to urinate at night for 2 years. I am just getting older. I have always felt tired. That is just my life. But symptoms that persist deserve investigation regardless of how long they have been there. The body is not supposed to have persistent, unexplained pain. It is not supposed to have consistent fatigue that does not resolve with rest. It is not supposed to wake you up every night to urinate. And these things have causes. And causes can be identified and managed, but only if someone asks the questions. And then the reason number five is trust issue with the health system. Many Nigerians have had experiences with the health system that have eroded their trusts, long waiting times, being dismissed or treated poorly, being charged less they did not expect, receiving care that did not help, or that they felt was inadequate. And these experiences are real, and they create a reluctance to go back. Why should I go when last time I waited 4 hours and left with nothing useful? That's what many people say. But I want to acknowledge this honestly. The Nigerian health system has real changes, but there is a difference between the system needing to improve and you staying away entirely. And so to your own, staying away entirely to your own detriment. So walk around the barriers where you can, find the facilities in your area that you trust, go to primary health centers for routine issues. They are often faster and cheaper than general hospitals, but do not let a bad experience with the system to be the reason you ignore a serious symptom. And the key fact is that studies in Nigeria consistently show that delayed care seeking is one of the primary drivers of poor health outcomes across almost every major condition, from maternal health to infection disease to chronic disease. So changing this pattern helps communities understand when to go, where to go, and why going early matters is one of the most important things public health communication can do. Now, to my audience, I'm going to ask this question. Which of these five reasons do you most recognize in yourself or your family? Cost, self treatment, fear, normalizing symptoms, or distrust of the health system? I want you to drop the number in the comments right now. Okay, so I'm going to start with something that every Nigerian knows about malaria, because malaria is so common in Nigeria that people have developed a familiarity with it that sometimes becomes dangerous. And the thinking is, I have had malaria before. I know what it feels like. I will just get the drugs from the chemist. I do not need a test. I do not need to see a doctor. And most of the time, that approach works on complicated malaria treated promptly with the right anti-malaria medication resolves in a few days. But sometimes it does not work. And the difference between uncomplicated malaria and severe malaria is not always obvious from the outside. Now, severe malaria, also called complicated malaria, is a medical emergency. It develops when the malaria parasite is not treated promptly or effectively and the infection progresses. And severe malaria can affect the brain, causing cerebral malaria, which can cause unconsciousness, seizures, and death or permanent brain damage. It can cause severe anemia by destroying red blood cells rapidly, and it can also affect the lungs, the kidneys, and the liver, and it can kill in hours, not days. So, what are the signs that malaria is becoming severe and needs emergency hospital care rather than home treatment? A child or adult who cannot sit up or is unusual or is on usually drowsy or difficult to wake. Seizures, convulsions, breathing that is rapid or labored, inability to drink or eat, vomiting everything, extreme weakness, unable to stand or walk, unconsciousness or confusion, urine that is very dark, almost black, which indicates a serious complication called black water fever, where red blood cells are being destroyed rapidly. Fever is very high and does not come down with medication. So any of the signs means go to the hospital immediately, not the chemist, not home treatment, but hospital. And nurses in the pediatric and emergency ward see children arrive, you go to they see children arrive with severe malaria who could have been saved if the family had brought them in a day earlier. So the parent knew the child had malaria. They were treated at home, but they did not recognize the signs that malaria had before, had become severe. They thought the drowsiness was just the fever. They thought the child would improve, and by the time they came, the window for easy intervention had closed. You get so. uh, Now, what about the other infections? Because Nigeria carries a significant burden of infectious disease beyond malaria. We have the typhoid fever, we have um, the magnetized sepsis, and the pattern with all of them is similar early symptoms that seem manageable, delay in seeking care, and then a rapid deterioration that catches families by surprise. We also have typhoid fever that is caused by bacteria, Salmonella typhi. It starts with prolonged fever, headache, and general malaise. It looks like any other um, febrile illness in the early stages, but if not diagnosed and treated properly, it can cause intestinal perforation where the walls of the intestine develop holes, which is life-threatening and requires emergency surgery. So the way to catch typhoid early is simple. Prolonged fever lasts more than 3 to 4 days, without an obvious explanation. So it gets a viral test or blood culture done. Do not assume it is malaria and treat it without testing. And then the meningitis inflammation of the membrane surrounding the brain can progress from first symptoms to death in 24 hours. So the classic signs are severe headache, stiff neck where the person cannot bend their chin to their chest fever, sensitivity to light, and in some cases a rash. So any combination of these symptoms need immediate emergency care and do not wait. Sepsis is something I want to explain clearly because it is widely misunderstood. Sepsis is when the body's response to an infection becomes so extreme that it starts to damage the body's own organs. It is not one specific infection, it can develop from any serious infection, including uh, peer pneumonia, urinary tract infections, wound infections, and postpartum infections. And so the signs of sepsis include very high or very low temperature, rapid heart rate, rapid breathing, confusion or altered mental state, and feeling extremely unwell in a way that is hard to describe. So, sepsis is a medical emergency, and every hour of delay in treating sepsis significantly reduces survival. And if someone seems dangerously unwell from an infection, not just ill, but dangerously, alarming unwell, do not wait. Go to the hospital immediately. And the key fact is that Nigeria accounts for approximately 25% of all global malaria deaths. And the majority of those deaths occur not because effective treatment does not exist, but because of delayed diagnosis and delayed care seeking. Knowing when malaria has become dangerous enough to require hospital care could save thousands of Nigerian lives every year. Okay, so now let's talk about hypertension and heart disease. And I want to approach this from the angle of how nurses see what arrives in the emergency room or the ward because someone waited too long. Nurses in Nigeria hospitals see strokes every single day, young strokes, people in their 40s and 50s, sometimes younger. And so, arriving with one-sided weakness, slurred speech, facial drooping, and in many of these cases, when the family is asked, "Did you know the person had high blood pressure?" The answer is yes, they knew. Person had been told their blood pressure was high. Maybe they were given medication. Maybe they took it for a while and stopped. Maybe they never started. Maybe they reduced their salt for a few weeks and felt better and assumed the problem was resolved. And so, hypertension does not resolve because you feel better. It does not resolve because you reduce salt for 2 weeks. It is a chronic condition, meaning it is a long term and it requires long term management. And when it is not managed, it silently damages the blood vessels and the heart over months and years. And then one morning, the stroke happens, the heart attack happens, and the family stand in hospital corridor wondering how this came out of nowhere. It did not come out of nowhere. The body was sending signals. The blood pressure reading were elevated. The medication was not being taken. The follow-up appointments were not being attended. So it came out of a long period of ignored signals. And what are the early signals of hypertension that people miss? The honest answer is hypertension often has no symptoms, which is why it is called the silent killer. But sometimes the body does give signals that get explained away. And so persistent headaches, particularly at the back of the head and neck, often in the morning. Many Nigerians have these headaches regularly and attribute them to stress, to sun, to hunger. Sometimes they are right. But when headaches are persistent, frequent, and located at the back of the head, they warrant a blood pressure check. Dizziness, feeling light-headed or dizzy without an obvious cause. Nosebleeds, frequent unexplained nosebleeds can sometimes be associated with high blood pressure. Shortness of breath, feeling more breathless than usual with activities that should not make you breathless. Visual disturbances, blurring or seeing spots. And for many people, none of these symptoms appear at all, which is exactly why regular blood pressure checks are so important, not just when you feel unwell, but as a routine part of monitoring your health. So, we're going to talk about the emergency signs of hypertension. Okay. A hypertensive crisis is when blood pressure reaches dangerously high levels, typically above 180 over 120, and the signs include severe headache, the worst headache of your life, like I mean the worst headache of your life, chest pain, shortness of breath, back pain, severe anxiety, visual changes, nausea and vomiting, confusion. These are emergency symptoms. So go to the hospital immediately because an hypertensive crisis can cause stroke, heart attack, kidney failure, and death if not treated urgently. Um, so I'm going to also talk about what nurses see with heart attacks. What do nurses see with heart attacks? Heart attacks where the blood supply to a part of the heart muscle is cut off, cure within hours if not treated. And the faster treatment begins, the less damage to the heart. And the signs of a heart attack are not always what people think. Yes, a classic heart attack causes crushing chest pain that radiates to the left arm, but heart attack also present as tightness, chest heaviness, a feeling of pressure or squeezing in the chest, pain in the jaw, neck or back, shortness of breath without chest pain, particularly in women, nausea and vomiting, cold, sweat, extreme fatigue, particularly in women. And so women in particular often do not recognize their heart attack symptoms because they do not match the classic. male, they do not match the classic male presentation. And by the time they come to the hospital, they have waited hours, sometimes days before they thought it was indigestion or stress or just feeling unwell. And so any chest discomfort that is new, that comes with shortness of breath, sweating, or pain radiating elsewhere, this is a potential cardiac emergency. Do not wait to see if it passes. Do not take an antacid and lie down. Call for help and get to a hospital with cardiac care immediately. And the fact is that for every 30 minutes of delay in treating a heart attack, significantly additional heart muscle dies. And the medical phrase is time is muscle. The faster treatment begins ideally within 90 minutes of symptom onset, the better the survivor and the less long-term heart damage. So every minute matters. Okay. Next is I want to talk about maternal health, because this is the area closer to the heart of the safe delivery project, and the pattern of delayed care seeking in maternal health is one of the most devastating thing I know. Let me tell you what nurses and midwives in Nigeria hospitals see. They see women arrive in labour who have been in labour at home for 12, 18, 24 hours, sometimes longer. Women who waited, women whose families assumed the baby would come eventually, women who had no antenatal care and therefore did not know their baby was in position that made normal delivery impossible. Women who had been with a traditional birth attendant who eventually said, "We need to go to the hospital," too late. They see women arrive with severe anemia, women who have been heavy and irregular bleeders for years from fibroids and have never been investigated or treated. Women whose blood count is so low that any blood loss during delivery becomes life-threatening. Women whose bodies do not have to reserve to handle what normal delivery demands. They see women arrive with pre-eclampsia that has already progressed to eclampsia. Women who had the symptoms of headache, swelling and visual disturbances for days or weeks. Women who were told at a clinic visit that their blood pressure was high and were sent home without proper follow-up. Women who had no access to regular antenatal care, and so the rising blood pressure was never detected until the seizure happened. The see women arrive with postpartum hemorrhage and excessive bleeding after birth, having delivered at home or in a facility without adequate blood supplies or equipment. Women who started bleeding heavily and waited hoping it would stop. Women whose families did not recognize the severity of what was happening until the woman was already in shock. Every single one of these scenarios is real. Every single one of them represents a woman who came too late, and every single one of them represents an outcome that might have been different with earlier recognition and earlier action. So, let me go through the maternal health warning signs that every pregnant woman and every family member of a pregnant woman needs to know. Severe headache that does not go away, with paracetamol, particularly in the second half of pregnancy. This can be a sign of pre-eclampsia, a dangerous condition involving high blood pressure that can cause seizures, stroke, organ failure, and death if not managed. Sudden or severe swelling of the face, hands, or feet, especially combined with headache or visual changes, also a sign of pre-eclampsia. Visual disturbance, blurring, seeing spots, flashing lights, a sign that pre-eclampsia is affecting the brain. Reduced fetal movement, your baby has been quieter than usual for more than 12 hours. The baby should be moving regularly from around 28 weeks. So any significant reduction in movement needs to be um, evaluated urgently. Vaginal bleeding at any stage of pregnancy, especially if heavy. Spotting in very early pregnancy can sometimes be normal, but any bleeding needs to be evaluated. Severe abdominal pain, particularly sudden severe pain, can indicate placental obstruction where the placenta separates from the uterus wall, which is a life-threatening emergency. leaking fluid from the vaginal before 37 weeks, which may indicate premature rupture of the membranes, needs urgent evaluation. Fever above 38 degrees Celsius during pregnancy, which can indicate serious infection that needs prompt treatment. And so during labor, you go to the hospital if contraction that are very frequent and very strong, but the baby is not progressing labor that is not advancing despite strong contraction, so it needs evaluation for obstructed labor. The baby's head is visible at the vaginal opening for more than 20 to 30 minutes without delivery. The baby may be stuck. Cord prolapse the umbilical cord coming out of the vagina before the baby. This is an extreme emergency. Get to the hospital immediately because the cord should not be pushed back in. The woman should get into a position that reduces pressure on the cord and transport must be immediate. Heavy bleeding during labor, signs of fetal distress, the baby is not moving well or the heartbeat seems abnormal. And then after birth, seek emergency care for soaking through a pad in less than an hour, passing clots larger than a plum, dizziness or fainting from blood loss, fever and foul smelling discharge signs of postpartum infection, severe headache, visual changes or upper abdominal pain after birth signs of postpartum preeclampsia, sudden shortness of breath or chest pain signs of pulmonary embolism and a blood clot in the lungs, rapidly worsening wound pain, redness or discharge from a C-section wound or perineal wound. So the key fact is that the leading causes of maternal death in Nigeria are hemorrhage, preeclampsia and eclampsia, sepsis and unsafe abortion. Every single one of these has early warning signs. Every single one of them is more survivable when recognized and treated early. The life that is saved by recognizing these signs could be yours or someone you love. Now, the next I'm going to talk about children because the pattern of delayed care seeking in children is heartbreaking, and nurses who work in pediatric wards carry the weight of it every day. Nigerian parents love their children deeply. Nobody waits too long because they do not care. They wait because they do not, they do not know when something is serious enough to go to hospital, and because they have tried what they know at home, because they are trying to manage the costs, because they have been to hospitals before and the experience was difficult. But children deteriorate faster than adults. And so, what is a manageable illness in an adult can become life threatening in a child within hours. The margin of error with sick children is smaller. And recognizing the signs that a child needs urgent care, not just care, but urgent care, is one of the most important things a parent can know. Now, I'm going to be talking about when to go to the hospital immediately with a child. The child is under 3 months old and has no fever at all. No, he has no fever at all. Any temperature above 38 degrees Celsius in a baby under 3 months is an emergency. Full stop. Do not manage at home. Please go to the hospital immediately. The child cannot be woken up or is unusually difficult to rouse. Drowsiness that is beyond normal sleep. A child who cannot be properly woken, who is limp, who does not respond normally when you try to wake them is an emergency. The child is having seizures, a first seizure in a child or a seizure lasting than 5 minutes or multiple seizures need an emergency care. The child is breathing very fast or with difficulty. Count breaths per minute. For children under 2 months, more than 60 breaths per minute is fast breathing. For children 2 to 12 months, more than 50. For children 1 to 5 years older than 40. Also watch for the chest caving in with each breath. This is called the chest indrawing and is a serious sign of respiratory distress. NASA, fla- um, NASA flaring, the nostrils widening with each breath, grunting sound with breathing, or any of these signs are emergencies. And so the child cannot drink or breastfeed. A child who is refusing all fluids or who is vomiting everything they take is a serious risk of dehydration combined with fever, and this also need urgent attention. The child has had diarrhea and vomiting and is showing signs of dehydration, signs of dehydration in children. It includes, now I'm talking about the signs of dehydration in children. It include sucking eyes, sucking fontanelle is one of the soft spots on the head of an infant, dry mouth and tongue, no tears when crying, no wet napping in 6 hours or more, skin that when pinched goes back slowly, extreme extreme legatory dehydration in children can become severe and life threatening very quickly, so also need urgent emergency. The child has a fever that has lasted more than 3 days without improvement, not necessarily an emergency on the day 1 or 2, but by day 3, a fever that has not improved with appropriate management needs investigation. The child has yellow colouring of the skin or eyes, jaundice. In newborn, particularly jaundice that appears in the first 24 hours of life, or jaundice that is deepening and spreading, need urgent evaluation. The child has a rash with fever, particularly a rash that does not disappear when pressed. Press a glass against the rash. If the spots do not fade, this can be a sign of meningococcal disease, which is a life-threatening emergency. Now, what do nurses wish parents knew? Nurses in pediatric wards wish parents knew how to count a child, how to count a child breathing rate. I wish they knew what normal looks like, so they could recognize abnormalities. They knew that a child who cannot be a woman is not a child who is sleeping deeply. It is a child who needs help immediately. I wish they knew that dehydration can kill a child within hours if severe, and wish they knew that coming to hospital early, even if it turns out to be nothing serious, is always the right decision when you worried about a child. Better safe than sorry is not a clutch with children, it is the right approach. And now the key fact is that 5 diseases account for the majority of child death in Nigeria. We have malaria, we have pneumonia, we have diarrhea, we have meningitis, TCs and neonatal conditions. Most of these deaths could be prevented with early recognition and prompt care seeking. And so teaching parents the warning signs of severe illness in children is one of the most effective child survival intervention there is. Next, we're going to talk about diabetes and disease together because they are deeply connected and the delayed care pattern with both of them is strictly similar. Um, Nurses in renal wards, kidney wards and diabetes clinics in Nigeria hospitals see a pattern over and over again. A patient arrives in kidney failure needing dialysis to survive, and when the history is taking its emergencies that they have had and that they have had diabetes or hypertension, sometimes both for years, sometimes they knew about it, sometimes they did not, but the kidney damage accumulated quietly without obvious symptoms and over a long period, and by the time they arrive large amounts of kidney function were already gone. The kidney are remarkable at compensating. You can lose up to 50 to 60% of kidney function before significant symptoms appear. This is both impressive and dangerous because it means people walk around with significant kidney damage and feel relatively okay until things are quite advanced. So now, what are the early signs of kidney disease that often gets missed? Foaming or body urine that persists. Yes, that is one of the kidney disease that often gets missed. Foaming or bodily urine that persists. Healthy kidneys keep protein in the blood where it belongs. But when kidneys are damaged, protein leaks into the urine and makes it foaming. This is one of the earliest detectable signs of kidney damage, and it can be found with a simple, inexpensive urine dipstick test. Swelling particularly around the eyes in the morning and in the ankles and feet later in the day. The kidneys regulate fluid balance. When they are not working properly, fluid accumulates. Changes in urination, going more or less frequently, getting up multiple times at night to urinate, urine that is very dark or very pale. Persistent tiredness and weakness as waste products build up in the blood because the kidneys cannot clear them properly. High blood pressure is difficult to control. Kidneys play a key role in blood pressure regulation, and damaged kidneys can cause blood pressure to rise and become harder to manage. Back pain below the ribs in the area where the kidneys are located. And for diabetes, specifically the early warning signs that people miss or ignore. Feeling very thirsty all the time, not ordinary thirst but an intense persistent thirst. Urinating very frequently, including waking multiple times at night, feeling unusually tired even after adequate sleep, blurring vision, wounds or cuts that take unusually long to heal, frequent infections, particularly skin infection, urinary tract infection, or recurrent thrush, tingling or numbness in the hands or feet, which indicates nerve damage already happening. Now, what nurses see with diabetes in Nigeria hospitals is patients arriving with what should be a routine condition that has been allowed to become a crisis. That diabetes ketoacidosis is a life-threatening complication where the blood becomes dangerously acidic in patients who did not know they had diabetes or who stopped taking their medication. Diabetic foot wounds on the feet that became infected because high blood sugar prevented healing, and nerve damage meant the person could not feel the wound developing. And by the time the wound was noticed, it was already severely infected, leading to hospitalization and, in too many cases, amputation. Now the question nurses want every Nigerian adult to be able to answer is, what is your blood sugar level? Have you ever been tested for diabetes? Do you have a family history of diabetes? Are you urinating frequently, feeling persistently thirsty, or healing slowly from wounds? So these are the questions nurses want every Nigerian adult to be able to answer. And if the answers is those questions are concerning, or if you have simply never been tested, please go and get a fasting blood sugar test. It is a simple blood test, it is available widely, and it costs a small amount, and it tells you something critically important about your health. Next, I want to talk about something that nurses say that is almost never discussed in the context of emergency healthcare in Nigeria, and this is a mental health crisis. Mental health emergencies arrive in Nigeria hospitals, but they often arrive without being recognized as such. A person who comes in for a physical complaint whose underlying condition is severe depression. A woman brought in after a suicide attempt who everyone around her said gave no warning. A new mother in postpartum psychosis whose family thought she had possessed. A young man with severe anxiety whose physical symptoms, chest tiredness, raising heart, shortness of breath led to repeated emergency visits before anyone identified what was actually happening. So mental health crises in Nigeria are delayed and undertreated for all the same reasons we discussed at the beginning. Cost, stigma, normalization, fear multiplied by an additional layer of cultural belief that mental illness is spiritual rather than medical. And that belief, and understandable as its origins are, is costing lives. Now, let me talk about some of the mental health warning signs that indicate someone needs urgent professional support and not prayer alone, not time alone, but professional evaluation. A person is talking about wanting to die, wanting to disappear, feeling like the world would be better without them. These words are not dramatic speech. They are not attention seeking. They are a signal that should always be taken seriously and always responded to with immediate support and professional evaluation. A person whose behavior has changed dramatically and rapidly, who has become extremely agitated or very withdrawn, or who is not making sense, or who is not sleeping for days, or who seems to be seeing or hearing things that others cannot. Rapid dramatic changes is a person's mental state and needs evaluation. Or a person who is no longer able to function, who cannot go to work, cannot care for themselves or their children, cannot leave the house, cannot manage any of the basic activities of daily life. Or even a mother who seems disconnected from her baby, who is extremely paranoid or confused, who is not sleeping at all, who seems to be experiencing a very difficult reality from those around her. Postpartum psychosis is rare but rapidly dangerous and needs emergency psychiatric care. So a person who has attempted to harm themselves, any suicide attempts regardless of how serious it seems is a psychiatric emergency that requires immediate hospital care and follow-up mental health support. Now, what should you do if you recognize the signs in someone you know? Do not leave them alone. Do not minimize what they are expressing. Do not tell them to pray and snap out of it. Do not call their behavior spiritual. Sit with them. Listen without judgment. Tell them you are taking what they are saying seriously and help them access professional care. A mental health facility, a psychiatric, a psychologist, and a trained counselor in a genuine crisis take them to the nearest hospital with a psychiatric unit. And for those who are struggling themselves, please tell someone, one person, one honest conversation. I am not okay is one of the bravest things you can say, and it is the sentence that opens the door to help. So, suicide is one of the leading causes of death among young people globally. And in Nigeria, where mental health is heavily stigmatized and services are limited, many people are suffering in silence with conditions that are treated and with pain that does not have to be permanent. Early recognition and early intervention saves lives. So this conversation starts with willingness to take mental health as seriously as physical health. Next, I want to spend a few minutes on something very practical. What do you do in a health emergency before you get to hospital? Because in Nigeria, where distances to healthcare facilities can be significant, where traffic can be severe, where ambulance services are not consistently available, the actions taken in the time between recognizing an emergency and reaching a hospital can make a real difference. For a stroke, remember fast, face drooping on one side, arm weakness on one side, speech difficulty, time to get to the hospital immediately. Do not give food or water to someone having a stroke. They may not be able to swallow properly and can choke them. So keep them calm, keep them in a safe position, get them to a hospital with stroke care as fast as possible. Note the time the symptoms started, and this information helps doctors determine treatment options. And for heart attack, help the person sit or lie in whatever position is most comfortable, losing any tight clothing. And if the person has been prescribed aspirin by a doctor and is not allergic to it, a single standard aspirin tablet, chilled not swallowed whole, can help. So do not leave them alone. Get to the hospital immediately. And for severe bleeding, apply direct, firm pressure to the wound with the cleanest material available. Maintaining that pressure without releasing it, because releasing it pressure to check the wound repeatedly interrupts clothing. So if pressure bandaging is available, use it. Get to the hospital immediately. And for a child with febrile seizure, a seizure caused by high fever, stay calm. Do not restrain the child. Do not put anything in their mouth. Turn the child onto their side so saliva can drain. Time the seizure, and once the seizure stops, give fever reducing medication if available. Also, go to the hospital If the seizure lasts more than 5 minutes or the child does not regain consciousness, emergency. And for postpartum hemorrhage, help the woman to massage her uterus, place a hand firmly on the lower abdomen and massage in a circular motion to help the uterus contract. Encourage the baby to breastfeed if possible, as this stimulates contraction. Keep the woman warm and also get to the hospital immediately. And for suspected poisoning or overdose, do not induce vomiting unless specifically instructed by a healthcare provider. Keep the person conscious and talking it talking if possible. Bring any medication bottles, containers or substances you think may help, you you think may have taken to hospital with you, and also get to the hospital immediately. In all emergencies, call higher to the hospital if possible so that they can prepare to receive you. Keep emergencies number saved in your phone. Know the location of your nearest emergency healthcare facility before you need it. And know that getting there fast matters. And so every minute also matters. Okay, so we have been here for almost an hour, and before I let you go, I want to say something that I hope you, if only they had come sooner. These 6 words represent thousands of families in Nigeria. And every single year, thousands of people who did not have to be lost, thousands of conditions that did not have to become emergencies. Today, we worked against those 6 words. We talked about malaria becoming severe, about high blood pressure becoming a stroke, about pregnancy warning signs that becomes life-threatening, about sick children who need to be seen urgently, about diabetes silently destroying kidneys, about mental health crises that go unseen until they become emergencies. We named the signs, we gave them language, we took away some of the mystery that allows people to dismiss them as nothing. And now you know what to watch for. You know when something has crossed the line from manageable at home to needing professional care. You know when urgent means now and not tomorrow. So use that knowledge, share it, tell the people around you, pin it in your family group, talk about it over dinner, because health knowledge is only protective when it moves from one person to the next until it reaches the person who needs it most. You came here today because you care about your health, about the people you love. That's that care, that commitment to being informed is exactly what changes outcome. It is what turns those sick words from a tragedy into a near miss. If only they had come sooner, we got there just in time. Get there just in time for yourself, for the people you love. So, please, I want you to like this video if today gave you something that matters. And also leave a comment telling me the one thing you are going to do differently after this section. One symptom you're going to stop ignoring, one sign you're going to watch for, one conversation you're going to have with your family this week. And also subscribe so you never miss a Thursday, and please share this video. Send it to a very parent you know, every pregnant woman, every family with a person managing hypertension or diabetes, every person who has been putting off a hospital visit, because this information belongs to everyone, and your share is the reason someone who needs it will find it. I'll see you next Thursday. Take care of yourself and please do not wait. Some emergencies don't happen overnight. They start with warning signs that are often ignored. So please share this with your family, your friends and loved ones, and also subscribe to this channel so you never miss a Thursday. Thank you.